So I'm Professor Montalescot, interventional cardiologist at Pitie, Salpetriere, and I'm the president of the Action Group.
And I'm Mathieu Kerneis. I'm a professor of cardiology at the Pitie Salpetriere Hospital, and I'm also an interventional cardiologist. So ARAMIS is talking about acute myocarditis. So acute myocarditis is an inflammation of the heart. It affects young patients that are frequently hospitalized for the first time of their life in intensive care unit. And these patients are exposed to a 3% risk of death and heart transplantation at 1 month, when we have an all-comers population, including either fulminant form, uncomplicated form of myocarditis. The study drug of ARAMIS is Anakinra. So Anakinra is an antagonist of the receptor of IL-1. We have a rationale based on experimental studies and case reports in humans suggesting that the inhibition of the IL-1 pathway could be effective in acute myocarditis. And Anakinra is an anti-inflammatory drug already used in many inflammatory diseases such as rheumatoid arthritis or recurrent pericarditis with an acceptable safety profile.
And we don't have good drugs for this disease so far. We give beta blockers, ACE inhibitors, but nothing really works for this patient. So we're trying to find something.
I think one of the key points is that when you look at the previous studies, there is only few studies on acute myocarditis. In fact, there is the MTT trial back in 1995 and the TIMIC trial in 2009. And both studies enrolled patients with inflammatory cardiomyopathy, not really acute myocarditis. So we did an academic trial coordinated by the Action Group. It's a randomized, multi-center, double-blind, phase 2B trial while enrolling patients with a suspicion of acute myocarditis. And when we have a confirmed diagnosis based on CMR, patients were randomized between Anakinra, 100 milligrams on top of standard of care, or placebo on top of standard of care, and all the treatment were administered during the hospitalization period. And then patients were followed up during 28 days, and we were looking at a patient-centered outcome, the number of days free of any myocarditis complication. What is a myocarditis complication? It is heart failure requiring hospitalization, chest pain requiring new medication, ventricular arrhythmia, or left ventricular dysfunction. We're also looking, and it's important because it's a phase 2 trial, we're also looking to a safety endpoint. That is the rate of serious adverse events, including those potentially related to the drug. So first we enroll an all-comers population of acute myocarditis, mostly at low risk of event. And for the first time, all patients had a diagnosis of myocarditis based on CMR. They were young, they were male, they had an history of recent infection, and there was absolutely no difference in the number of days free of any myocarditis complication between the Anakinra group and the placebo group. When we look at the clinical event rates, there was a 10.5% event rate in the Anakinra arm and a 16.7% event rate in the placebo group. We are not powered to draw any firm conclusion on this number. And when we look at the rate of chest pain requiring new medication, there is a 3% event rate in the Anakinra arm and a 10% event rate in a placebo group. There was no safety issue with Anakinra. I think it's an important message. In particular, there was no safety issue with serious adverse events related to the drug. And that's it.
Yeah, I think it's a little bit disappointing because it's a neutral result, but we have some signals on symptoms especially that may be interesting for the future. And again, this kind of study is not easy to do. It's a rare disease in young patients, and we need lots of centers to recruit a small sample size, as you can see. The next step is probably to look at more severe conditions of myocarditis, or maybe to treat longer the patients, but we will see other randomized studies in the field.
So there is like two ongoing studies on acute myocarditis. There is a MIT trial led by Professor Amirati, which is the discussant today of the trial, that is recruiting patients at high risk of event, patients with a fulminant form of myocarditis that are randomized between corticosteroids and placebo. And there is also the ARGO trial, which is also an action group trial that will randomize 300 patients with a low to mild risk of event myocarditis, but this time we will treat patients for 6 months and try to have a better result than with the ARAMIS trial.
With another anti-inflammatory drug, huh?
Yes, with another anti-inflammatory drug, the colchicine, targeting finally the same pathway.
Yeah. So it's an inflammatory disease, and we are looking for an anti-inflammatory drug working. Corticoids, colchicine, Anakinra, and we need to find something for these patients. For now, we are left with a few effective treatments.
With 120 patients, ARAMIS is the largest trial on acute myocarditis and on all patients mostly at low risk of event. There is no difference between the two groups on the primary endpoint, but there is no safety issue and interesting signal. Clearly, this is not the end of the anti-inflammatory strategies for these patients.